Dewey,
Here.
Littell. Here. 6 present, 2 absent. First up on our agenda is Langdon Chapman, Commissioner of Human Resources. Let's see, we have a stand-in Langdon.
I am Allison Tyak, Deputy Commissioner of Human Resources.
Hi, Allison.
How's everyone?
Good, how are you?
Good, thanks.
So first on is letter A1, request to authorize a grade increase for the public health nurse position from grade 14 to grade 16. And that position be hired at step 5 with a salary change from $42.53 an hour to $49.81 per hour for 2025, when deemed necessary by the Commissioner of Human Resources. This is legislative request number 48.
So
Can I
moved.
get a motion? Second.
Thank you. So Human Resources has worked closely with the Health Department, specifically on recruitment challenges for nursing titles. Public health nurse continues to be an issue with recruitment. Given the current environment with nursing recruitment, grade 14 just no longer seems to be viable. So we are here to request the grade be reallocated to a grade 16 and to also request the advanced step higher of 5. Lisa Lahith could probably expand upon some of their recruitment difficulties if you had any questions on that.
So we did have a very large number of nurses either retire or resign after COVID. You know, we were working 14, 15-hour days, and then after that, a fair number of folks who are retirement age decided to retire. Some of them we roped into coming back and helping us out, but they've decided to completely retire at this point. And we have not been able to fill their positions at all. The people who come to interview for the positions, as soon as they find out what the salary is, they immediately decline. And we had our last public health nurse resign at the end of the year last year. So right now we have no public health nurses. We have 2 supervising public health nurses and a director, where we used to have 8, 9 nursing staff. Now we have 3.
So to
Yeah. Now that seems like a good jump, but will it put you in a good position where they maybe not turn down turn their nose up at it and be like, no, that's not enough? And, what kind of price range are you competing with now?
Well, what we're hoping is that it will attract the right kind of person. You know, obviously, public health nursing is very different than nursing in an acute care setting. Patient acuity is much less. The physical demands of the work is much less. I think I've told the story probably to you before that my 26-year-old daughter has one of her very best friends who's a nurse who makes $250,000 a year nursing at 26. We're not going to compete with that ever. But what we're hoping is that this will be more attractive to folks who are maybe just looking for a change in their career. People who maybe have a family to raise and like the regular hours, those kinds of things. So we're hopeful. As I think I mentioned at the last Board of Health meeting, we're trying a lot of different things. This is one of those things. We're also putting through different procurement devices for contract nurses, contract agencies. So we're trying to fulfill the requirements of our Article 6 funding and of our vaccination grants and other grants.
And that's been going down steadily. And now this is the first time I'm hearing that you're down to 0 now. So
Yeah.
good luck.
Yes. Thank you.
legislative items.
Yes. How has this impacted, any programs or services in the Department of Health having the shortage?
I would say that probably primarily our beautiful health bus, Health Grows Here, hasn't been out of the parking lot for quite some time because we honestly don't have the nursing staff to staff it and staff the office. We have now a vaccination program that has no dedicated nurse working in it. And we just found out today that our CDC fellow who was helping us out has lost her job due to the CDC cuts, so we don't have that help either. So I think, you know, we have to do the things that we have to do, but those, you know, extra clinics, extra, you know, we do vaccinate people who are going to exotic places and need maybe like a yellow fever vaccine, so we're not really doing that now because that's an extra. You know, like I said, we have to try something. The poor two nurses that we have are very tired.
Listen,
Is a public health nurse an RN?
A public health nurse is an RN and a BSN.
Oh, no, that's just. But it was specific requirements.
Right.
It's not a licensed practical nurse. So, RN.
Right, so the licensed practical nurse is in just one moment, but also we do have one RN position available. As you probably know, most people who are going into the nursing field, if they're going into nursing and becoming a registered nurse, they're getting their BSN. It's sort of become a floor, not a ceiling anymore. So we're hoping that that we can recruit those people.
Thank you.
thank you, Mayor.
Do you have a table or a chart of what our competitive health providers are paying?
Yeah, we did some research. We could share that with you of surrounding hospitals and different agencies. So,
Yeah, you could give that, send that to the clerk. You don't need to
Sure.
hand it out
Okay.
now.
sure.
Thank you.
Thank you.
Doreen, could you also let the record reflect that Chairman Hines is here as well as Majority Leader Ben? Thank you. Anybody else have any further questions? Okay, all in favor?
I,
Any opposed? Okay, motion passes. Next, we have A2, request to authorize the hiring of licensed practical nurses at step 5 in the health department with a salary change from $25.12 to $29.16 per hour when deemed necessary by the Commissioner of Human Resources, legislative request number
so
48.
moved.
Second.
So along the same lines, finding it difficult to recruit for LPNs. The position was created last year as a grade 8 starting salary for new positions. They come in at a step 2. That has proved to be difficult. So we are here to request just the authorization of the step 5, the advanced step recruitment. The grade 8 still seems to be appropriate. LPNs at Valley View are also grade 8s. They are authorized to recruit at the step 5. So we would just be asking the same. A little different is that LPNs in the health department are on the regular CSEA schedule. Valley View LPNs have a differential schedule. So the LPNs at the health department will ultimately make a little less money than the Valley View LPNs, but the nature of the job is different as well. So we're just here to request the advanced step higher.
Anybody have any questions? All in favor?
Aye.
Any opposed? Thank you. Thank you very much. Next, we have Lacey Trimble, Commissioner of Social Services and Mental Health. So item A, request to accept and appropriate funds from the New York State Office for Mental Health to support Forensic Court Navigator in Orange County. The Forensic Court Navigator will work with local systems to coordinate voluntary care for justice-involved individuals to support their health, wellness, and recovery in the amount of $210,090, legislative request number 37. Can I get a second?
Second.
So this was an allocation of funding. We did have to submit a plan to the state and have it approved, but the amount was determined by the state before the plan was submitted. The funding will help us improve coordination between the court and service providers with the goal of improving outcomes and reducing recidivism for people who are involved with the court system and have co-occurring mental health needs. We already are in several courts throughout the county, and this position can also, or this funding will also help us to coordinate all of the different courts and make sure that there's consistency in process for all the different specialty courts that we're involved with.
Anyone have any questions? First citizen?
Specialty payments is like 25-30% of the total, 210,000. You have a good breakdown, everything else. What is the bulk of specialty services?
So specialty payments, we are waiting for OMH to clarify what we can include in that. Can we help for transportation to get people to and from appointments? Can we help them to obtain housing if they need a security deposit? So it's in a general category right now because the state hasn't clarified those for us, but we're hopeful that we'll have that clarification soon.
So this forensic person's got $81,000 salary
Mhm.
and benefits. for that. Thank you.
Any other questions? Vice Citizen?
This new speak drives me crazy. Justice involved individuals, someone at OCJ.
So somebody who is involved in the court system, they may not be sentenced at this point, but they're going in front of a judge. So they could be in mental health court, they could be in opioid court, in drug court, in veterans court. So they may not end up sentenced. They may end up with, do X, Y, and Z with treatment providers and
Okay.
potentially have an ACD at the end of the process.
All right, thank you.
Thank you. Anyone else? Hearing no further questions, all in favor?
Aye.
Any opposed? Item number B, request to accept and appropriate state funding from the New York State Office of Mental Health, New York State Office of Addiction Services and Supports, and OPWDD, New York State Office for People with Developmental Disabilities. This amount is the difference from the state aid entered in the Department of Mental Health's 2025 budget to the total amount of state aid allocated in the state's funding letters issued in 2025 to their contract agencies in the amount of $267,481, legislative request number 38. Can I get a motion?
So moved. Second.
Please.
So the amount of state aid that was budgeted for our contract agencies in 2025 was based on what we were given at the time of $18,843,706. The most recent state aid letters we received came in higher at $19,111,187. So we're requesting to add the difference of $264,487 in state aid to the contract agencies. They are earmarked for certain programs throughout the county.
Any questions? All in favor?
Aye.
Any opposed? Can I get a motion for the monthly report, please?
Moved. Second.
So we partnered with the sheriff's office to sponsor a Homeland Security Threat Evaluation and Reporting course this February. It was the 10th through the 12th at the Emergency Operations Center. It was facilitated by New York State Office of Counterterrorism and Domestic Terrorism Prevention Unit. It was really attended, pretty well attended and regionally represented. We had mental health, law enforcement, higher education, other county governments sent HR, staff. The training provided good information on assessing risk for targeted violence, what you need to do as far as reporting, monitoring, and how you manage those cases when somebody hasn't necessarily committed a crime, but there are warning signs that they could be somebody who could perpetrate some kind of mass violence attack. This is really important for our threat assessment and management team that is working to make sure that we have all the tools necessary to monitor those kinds of cases and work collaboratively to hopefully get somebody off the pathway to violence and into whatever services they may need. Our disaster mental health team did a presentation as part of the Office of Mental Health Planning workshop on disaster mental health. we realized that a lot of counties don't have a team like we have in Orange County. Some counties established them after 9/11. I did some digging. We established this team when I was in elementary school after the Coldenham tornado hit the cafeteria. So Orange County, that happened in 1989. We've had a team since 1990. We are still going to take advantage of the technical assistance that's provided to update our plans to make sure we're using all the best practices, but we're also providing presentations and helping other counties get their teams up and running. And it'll help us hopefully expand our team.
Yeah, it's a great team.
Yeah, they really have done a great job and been asked to go out a lot in the last 2 years.
Yeah.
Update on our county operated clinics. We have received one operating certificate, actually just last week on the 12th for Valley Central Middle School. So we will work on opening that satellite location, putting out a advertisement for a contractual clinician for that service. In January, we had 100 admissions, 98 discharges from service. And this is all of our programs, clinic and satellites. 1,558 people were served, and we provided 3,623 services. Almost 1,000 of those were in our satellites. And I just put a little note that the governor announced during the state of the state address an expansion potentially to Kendra's law and expansion of voluntary commitments. Kendra's law is what created the assisted outpatient treatment program, for lack of a better word. We call it APT, and it is for the highest need individuals in our county to ensure that anyone with a mental health history, significant hospitalizations, and violence history who is not participating in treatment can get court ordered if they meet eligibility requirements to participate in that treatment and have an intensive team who supports them. We have between 30 and 40 people on AOT orders at any given time in our county. I don't know what an expansion would look like, but it was something that was put forward as potential. The other thing that was put forward as potential to change the involuntary commitment regulations. Right now, involuntary commitment is what we use 945s for. Our mobile response team use 958 for those to transport somebody who it seems that they have a need for treatment in a mental health hospital in order to keep them safe. They have clarified in recent years that the substantial threat to harm that is required to meet that level where you would be able to involuntarily commit somebody includes refusal or inability to meet their essential needs for food, shelter, clothing, and medical care. And that they have a history of noncompliance with treatment as well that would put them at risk could also be used for that. So we're not sure what that's going to look like, what the changes are going to be, but we're watching it closely because those are both things that have a significant impact on our county system of care if they change it in any way. That's all I have for the update.
For next month, on the numbers that you give us, especially the people served, is there any way you can give us that and a breakdown by clinic, like clinic satellite? You know, like
Yes.
we have this many at this clinic, this many at this satellite, so on and so forth. Thank you. Anybody have any questions? Oh, sorry, that's understandable.
With this possibility of the expansion of Kendra's law, especially, and if we have 30 to 40 people right now that we help, that number could become astronomical. And then how do we handle that as far as financially? How do we handle it as far as people to be able to provide those services?
So we are already in the process of getting approval to expand our case management resources because intensive case management is required, and it's an additional designation that a case management program would need to get. So we are working with the state for them to certify another agency to provide that because we were already having some struggles having enough case management. We have actually the training for that new agency coming up this week. So that will expand that pool of resources. There is a push from the Conference of Local Mental Hygiene Directors to say, if you're expanding these things, then funding needs to expand as well to the local government unit in order to provide those services. We don't know what will come of that yet, but we will be advocating for additional funds if they do change, depending on what it looks like.
Okay, thank you.
Thank you. Anybody else? Thank you, Lizzie. Next up, we have Lawrence Ledoux, Commissioner of Valley View Center, and Donna Strecker, Director of Finance, Valley View Center.
Good afternoon.
Good afternoon. Long time no see. I was just with Lawrence and Donna earlier today. So can I get a motion and a second to go over the monthly financials? Second.
All right, good afternoon, everyone. How is everyone? Good. Today, we're going to be reviewing two financial reports. One is an updated December financial as of 2/13, and the other one is our first publication of the financials for January 2025. So if we look at December, there's been no change to the IGT number since our last publication. IGT came in at 13.4 million. That represented the state fiscal year April 1st, 2023 to March 31st, 2024. The year-end entry for interest has not yet posted. There was no emergency disaster recovery money in 2024. And our other revenues coming in at 36.375 million. On the personal service side, we expensed 19,700,000. On the contractual side, we're pretty much wrapping up there. You'll see that encumbered expense number now is at 81,000. So we're processing all the invoices. We're at 13.7 million right now in actual expense, with 81,000 still earmarked for expenditures. The indirect cost has posted, that's the charge for the county services. That charge is 2.293. That charge is higher than the budgeted number. There's a 2-year lag in that number, so there was a couple of changes to it. So that was an impact to us that was unbudgeted. And employee benefits coming in at 16 million, and a small amount of serial bond debt at 65,102. Okay, so we're going to move on to the January financials. In January financials, we're starting the year with a budget of 58,988,927. We have budgeted 7 million for IGT. The appropriated surplus was the money that we needed to balance the budget at the time we submitted it, and that entry does not post until year end based on the operating losses of the facility or gains. Revenues, we budgeted the 38.8 million. For the first period of 2025, we have realized 3,315,466 in revenue. And when I was looking at this number before the meeting, I noted that it was significantly higher than last year. So I did a little digging, and what I realized, and I apologize, I did not footnote this, but we actually got over $500,000 from the Department of Health for appeals that we had filed. Was it 2011?
2011.
2011.
14 years it took us to
14
go.
years.
Within this.
Yeah,
Now-
right. Good luck.
Yeah.
For the appeal process, holy cow.
Can you imagine?
Imagine, and I don't know if you all recall, but there was this whole universal settlement many years back, and this was an appeal that was actually carved out of it. It had to do with the fact that Valley View in the county of Orange downsized based on a mandate. We went from 520 beds down to 360. And as a result, the calculation that they were using to figure our rate was inflated with the bed size. So it took them all this time to make good on it. But we're very happy for the revenue. Even if it did take all those
Well,
years.
yeah.
Legislator Benton, Minority Control.
How many more appeals are out there? Do you do that very often or,
We don't have too many out there. The universal settlement, there was a very large backlog of appeals. And so part of this universal settlement was litigation that, brought forward all these appeals. And we did get a substantial amount of money for that several years back, but I can let you know.
That's a good question. Fortunately, we don't have to do too many because there aren't too many errors.
Mhm.
But when our accountants do notice an error on their end in the reimbursement, that's when we file an appeal.
you let Jean know? That'd be great.
Yeah,
I'll let you know.
Great,
yeah.
thank you.
Personal services, we've expensed just under 1.7 million. On equipment, we've purchased 1,805. Contractual, we have about 6.597 million that is earmarked for expenditure. And we've actually expensed 193,613. That is typical for January because we're busy working on year-end 2024. Employee benefits, 1,243,578, and a small amount of serial bond interest at 1,983. And if you turn to the next page, you should be looking at the analysis of payer sorts by days. It's January. Our Medicaid census billable days were represented 71.22, Medicare HMO 3.02, and Medicare coming in at 10.10. Private pay at 13.66. Our census is still being impacted by, the staffing, particularly on the LPN side, and I think Lawrence will talk a little bit about that later. And also the number of deaths that we're experiencing in the facility as well. And that's just really a byproduct of the aging process.
Any questions?
I have my monthly update. I hope everyone got a copy of that.
Can I get a motion for monthly update?
Oh, sorry.
Sorry.
It's so.
So our census today is 62.5%. I put in the census from the date originally when I did this update, based on 360 beds or just under 83% based on 270 beds. For January, we had 40 admissions, 22 were new admissions, and we had 18 readmissions. Unfortunately, we did have 13 deaths in January, which is a very high number. We've had a large number of deaths, both in November, December, and January, those last 3 months, unfortunately. We had 17 discharges to the hospital, 9 discharges to home, and 1 discharge to another facility. For the child, our census is 14. For the month of January, we had 6 new admits, 8 discharges, and we conducted 182 therapy treatment sessions in the home for our clients. We purchased a fiber optic endoscopic evaluation of swallowing equipment. It's called a FEES machine. This committee and the full legislature approved this piece of equipment through a capital project. And this device will allow our speech therapists that are trained to use this equipment to conduct swallowing evaluations on our residents on site and preventing them from going to the hospital for this test. And we anticipate starting this treatment in-house in March, and we're very excited about that. And that's about it.
Anybody have any questions? Legislator Sutherland?
When you have such a high number of deaths, are there services for like the nurses and the aides and whatnot? Because for many of them, if they're, if your residents are there for years and years and years, they become family, they are family. So are there things in place for them?
We don't have anything in place in-house. A lot of the staff will actually go to the service in the community because they do almost become friends with the family members and the residents. So they do, a lot of them do attend the services in public. We do have, what's the service provided for our staff? EAP, thank you. We have the EAP we can offer staff if they're, grieving. And we do refer staff to that from time to time. It is a free service to all Orange County employees, so.
Because I have recognized as well, like before you even, like when I would get into reports and read them, before the meeting, and I have thought to myself.
Stuff, yeah, it's tough.
A lot.
It's tough. Yeah, I know during COVID, the state had a lot of, free services for that type of thing, for the burnout and for, all the people
Sure.
that were passing away during COVID. And I don't know if they're offering that anymore, but, we had those posters all around the facility during that time. So staff can access that if they needed to.
Thank you.
Yeah,
Thank
you're
you,
welcome.
Chairman.
Do these numbers, Lawrence, mean the state and Albany's gonna come down and looking for doing inspection or?
No, we have a regular recertification. We have to get recertified by Medicare and Medicaid. It's supposed to happen, when I first started, we used to have surveys annually, and now it seems like it's every 2 or 3 years. So we're due any day now for our recertification survey. That's when they look at a lot of these things. If the number, was really high, I'm sure they may come down for a off-schedule on-site survey, but, these numbers are, if you look at our past numbers, I think we always have a few months where we have, spikes, and it's a lot of times it seems to be in the winter. for some reason. I don't know why.
At least.
Yeah, so, but this wouldn't trigger anything.
No, okay.
It's not that big out of range, but it is larger than normal, so, yeah.
Thank you.
Any other questions?
Okay.
Thank you.
Thank
very
you.
much.
Thank you.
Next up, we have Dr. Jennifer Roman, DO Medical Examiner, Acting Commissioner of Health, Lisa Lahit, Deputy Commissioner of Health, and Gretchen Worden, Deputy Commissioner of Health.
So it's just me.
Just Lisa. She's flying solo. Okay, so first up, we have item A, request to create one Health Department Grants Coordinator, grade 13 position. This position is stipulated position and contingent upon grant funding through the Public Health Infrastructure Grant. Legislative request number 31. Can I get a motion?
So moved.
Second.
Thank you. So the CDC's Public Health Infrastructure Grant, or FIG as we like to call it, is an effort to support critical public health services after COVID. There are a lot of approved uses for this. The money went from the CDC to New York State and then funneled down to us at the health department. And one of the approved uses is to approve new positions within health departments. And one of the positions that we felt that was really needed was a grants coordinator. And this person would do several things. We have about 22 grants from a number of different funding sources. And we have the operational people who are working in the grants and doing the good work that they do. And then we have the fiscal people who are making sure that all of the things are sent to the right funding source to get payment. And oftentimes there's a gap between those two groups of people. And we're hoping that this person will be able to bridge that gap, that the person will be able to have a lot of financial background, but also be interested in the operations of the individual grants. Hopefully also, of course, we don't know what's happening, but we'll be able to seek out other sources of grant funding to decrease the tax burden on the taxpayers in Orange County for other work that we would like to be doing in the health department.
Do you have any questions? No. All in favor?
Aye.
Any opposed? Okay, next up, we have item B, request to accept and appropriate funds from New York State Office of Children and Family Services for years 2 through 5 for the Child Fatality Review Team contract, $20,072. Also, request to appropriate 2-year funding, $68,609. Legislative request number 47. Can I get a motion in a second? Second.
And so the Child Fatality Review Team is a group of people from the medical examiner's office, can be people from law enforcement, can be people from DSS, it can be people from CPS, who investigate the cause and manner of childhood fatalities in cases in Orange County. This team will get together, review the circumstances of each death at a 10-day interval and then at a 45-day interval. And the purpose of this review is to determine whether the cause of death or the manner of death could have been avoided. So they do other things like they provide pack and plays, they provide information about safe sleep for infants, they provide those baby sacks for new parents, and they work closely with our puppy program. But the result of this is generally from unfortunately an infant death. So the $20,000 is a increase in the minimum wage that happened in New York. So we are going to go back and use that for that. And then there is a Schedule A for the other expenses for grant if anybody has any questions.
Anybody have any questions? All in favor? Any opposed? Okay, we have a motion and a second for the monthly health department update.
So moved.
Second.
Oh.
Last page.
I have too much paper. You pass her our packet. It's on the last page in our packet here.
Thank you. All right, so we have a lot of great things happening. If you follow us on social media, you will see that we had a huge turnout at the Newburgh Armory for our Sweetheart screening. Over 350 people were there, where Mr. Kaplan was so impressed that he wants to have more of those kinds of things. So we're, looking for more community agencies who are interested in that kind of thing. It was a lot of music and a lot of fun and, prostate screening. So it was good. It's always good to have community members become more aware and increase their health literacy in for themselves and their families. And then I think the only other thing that I want to mention is I can certainly answer any questions about this, but we don't generally talk about environmental health too much here. But I just wanted to say that we issued over 3,000 permits. So we permit restaurants, we permit food trucks, temporary food services, pools, temporary residences, hotels, and things like that in Orange County. We're also still ongoing with the lead rental registry. We also inspect over 500 drinking water systems in any given year to make sure that the water that we're drinking is safe. Does anybody have any questions?
I have a quick question. I noticed that there have been reporting about the uptick of flu across the country. See the avian flu on here, Sierra flu and COVID. Have you seen any taxation of our clinics or anything in regards to?
So we don't generally have flu clinics, like as far as giving flu shots or anything like that. Most people will have that paid for with their health insurance. But if we have an adult travel clinic, we can give COVID, Mpox, and flu vaccines for a price. But we generally don't have folks who come to those. The need really hasn't been. We do have one for employees where they can get it at a reduced rate, but again, our insurance generally pays for it too. Flu in New York is generally coming down. It's up elsewhere in the country, but it's sort of coming down. There's still a lot of flu around, There was a question that I have been asked about the H5N1, the avian flu, about eggs, which, now, you have to like trade like a car in to buy a dozen eggs. But about which eggs are better. And, the general wisdom is that as long as you are storing your eggs, that is in a refrigerator, and cooking your eggs, then you should be okay with either kind of egg. People who eat raw eggs might not want to right now.
Yeah.
Was that Rocky was the last one?
That's Rocky, seen that for
1978.
protein building, yeah.
That's
Oh,
right,
yes.
that's
Yeah.
right, yeah.
Thank you. Does anybody have any questions? Thank you. Well, that clears our desk. I'd like to get a motion to adjourn, please.
So moved.
Second?
It's encouraging people to go by, huts for the, getting chickens in the backyard. Two New York City stations this weekend. had programs where they